Good morning, everyone. Thank you so much for joining us. Today we are having Dr. Shittu of BLOOM Fertility Clinic joining us today to answer our questions about IVF treatment options in Nigeria. So if your friends are not already here, do invite them to join us because it's going to be a very informative session this morning. So I'm Ola of Fertility Conversations, and a fertility health coach as well. Currently trying to conceive myself and working on becoming a mom. And I think it's really important that we see that we educate ourselves and also become aware of the options that are available. That way we're able to make informed decisions. So that's why I'm so glad that Dr. Shittu of BLOOM Fertility Clinic. Hello, how are you this morning?
I'm good, and you?
Good.
Amazing. Heart
Yes,
good.
yes. Thank you so much, Dr. Shittu. Thank you so much for graciously agreeing to join us this morning to answer our fertility-related questions about IVF options in Nigeria. We're really excited to have you here. Thank you so much.
Thank you for having me. It's an absolute pleasure as well. We need to have this conversation because
Definitely.
we know how it is with fertility, right?
Yes, thank you. And how are you doing this morning?
I'm doing okay.
Great.
Good.
Great. Thank you all for joining us. Welcome to everyone that has joined us this morning. How are you doing? Please remember to also invite your friends as well, so that way they can also be aware of this informative session. And BLOOM Fertility Clinic also has a special gift for everyone that has joined us this morning, and I'll be sharing that with us shortly. I'm just waiting for South Shore as well to... let's just see if I want to see if they have an invite so that way they can also join us. Okay, so while we are waiting for South Shore to join us this morning, Dr. Shittu, for anyone that doesn't already know you, can you please tell us a little bit about yourself and what your role is at BLOOM Fertility Clinic?
Okay, thank you, Ola. I want to thank everybody who has joined this IG Live for taking time out of their busy schedule to join us. I'm Dr. Olawale Shittu. I'm a fertility physician with BLOOM Fertility Clinic. I'm passionate about everything fertility. I have a bias for reproductive and fertility medicine. And because I realized that the inability to conceive or have a child can leave long-lasting psychological and emotional trauma in people. And we know that a lot of our culture, not only in Nigeria, all over the world, one of the yardsticks used to assess a relationship, a marriage, is the ability of the couple to have children. So fertility is something really important that we need to talk about. And I've been doing this for over 5 years. I've had the grace and the opportunity to take this journey with a lot of couples. And yes, we have couples that we have been able to see to a successful outcome. Of course, we have some that we didn't get it, but the main thing is we took that journey together, and we tried as much as possible to support them through the journey. So for me, it is a passion. And with BLOOM, I'm one of the fertility doctors.
Thank you so much for that introduction, Dr. Shittu, and for also highlighting that you're very passionate in helping us and everyone else that are trying to conceive to be able to achieve that dream. We really appreciate all that you're doing in this space to support everyone. Thank you. So I've noted for people to put in their questions in the comments, and I also had some questions that were already highlighted and sent to me prior to this live. So I'm going to try as much as possible to go through as many as we can within the next hour.
That's
So
fun.
yeah. Firstly, I have here, someone noted that, of course, Nigeria now is a prospective destination for IVF treatment because of the first-class fertility specialists that we have in Nigeria, like yourself, but also the cost and the option of donor gametes and surrogacy. So could you highlight for us what are some of the IVF treatment options that are available at BLOOM Fertility Clinic?
Okay, awesome. Now, like you mentioned, Nigeria has become popular for fertility treatment. I can confidently say with a lot of pride that we have a lot of experts who are skilled in this field, and we can give you the same treatment, the same quality, the same technology that is available anywhere in the world. And for us at BLOOM Clinic, yeah, we latch onto that as well. In terms of the IVF treatment, we don't only do IVF, we do everything fertility. We start from the fertility consultation, fertility assessment. Then based on what we find from the assessment, we determine what treatment best suits the couple. We do an IUI as well, intrauterine insemination. Then we do IVF. And in terms of IVF, for people who don't know what IVF is, it is just fertilizing the eggs outside the human body, under a controlled environment in the laboratory to create embryos, which are now transported back into the womb of a woman. And for IVF treatment services, you can have own eggs where the woman uses her own eggs for the process. And for some women, because of one reason or another, maybe age, egg reserve is low, or they've had some form of treatment where their reproductive ability has been affected. We use donor eggs as well. So we offer donor egg treatment services. We also offer donor sperm treatment services for scenarios where we do the seminal fluid analysis of the male partner. We find out, okay, there is no sperm for us to use for treatment. Then in terms of, you mentioned surrogacy, we also do surrogacy treatment services. Then there's something called pre-implantation genetic testing, which is assessing the embryos for one, if there's any risk of transmitting a genetic disorder, if there are any chromosomal abnormality, and also we know that family balancing, it's important for some people, although it's not something that we preach because every gender is equal. We are preaching gender equality, but we do gender testing as well because we know there are certain medical conditions that are linked to certain genders, so that those genetic disorders are not passed. We can, with pre-plantation genetic testing, yes, you can do the assessment and we offer all of those treatments. So for IVF, we do one treatment cycle, we do donor eggs, we do donor sperm, surrogacy treatment cycle, pre-plantation genetic testing as well.
Wonderful. That's a whole lot. Thank you so much for detailing all the services and options that you do provide at BLOOM Fertility Clinic. Now, you mentioned pre-implantation genetic testing, and I wonder, one of the questions I had here was from a couple who indicated that both AS genotype, and so they're aware that they can get pregnant and then have a testing, amniocentesis, I believe, done sometime in the pregnancy, but they're wondering, is there an option to find out the genotype before even conceiving?
Yes, it is possible. With the pre-implantation genetic testing, PGD, you can, we know technology has advanced now with a strand of the hair, with just the inner cheek swab, you can assess the DNA of someone. So the same methodology is used in IVF as well. When the embryos are created, a small biopsy is taken, which is taken about a couple of cells, which is sent to a specialized laboratory where this is analyzed. And that analysis can tell us about if there are any chromosomal abnormality in that embryo that is analyzed, if there is any genetic disorder like sickle cell disease, which is what this couple are trying to avoid. It can tell us the genotype of the embryo as well, and it can also tell us the sex of the embryo as well. So yes, for this couple, there is a testing that can be done, and unlike the amniocentesis that is done during pregnancy, you know, that now creates a dilemma. Because if this test is done while the woman is pregnant, and it comes out that the baby maybe has a genotype sickle cell disease, SS, you're now left with that dilemma. Do we want to terminate this pregnancy, or do we want to go on with this pregnancy? And not everybody is comfortable with terminating the pregnancy. But for the pre-implantation genetic testing, once you do this testing and you can look at the result and say, okay, for this particular embryo, this has a sickle cell disease. This is a carrier and this is free. So you can take a decision on what embryo to transfer before a pregnancy happens. So that is what we offer as fertility clinics. We do that pre-implantation genetic testing so that at the point where we have all the results, we can sit down with the couple and say, okay, your results have come back from the embryos that we analyze, and we have this embryo that has this is a genotype of this embryo. Is it AA? Is it AS? Is it SS? And a decision can be taken on which embryo to transfer and which not to transfer. And that, in quote, saves that dilemma of, okay, do we want to terminate this pregnancy or not? So yes, it is possible with pre-implantation genetic testing to guide and help a couple determine the genotype of the embryo before they do a transfer.
Thank you so much for highlighting that. And is that available at BLOOM Fertility Clinic as well?
Yes, it is available. It's something that we offer. Yes.
Okay, wonderful. Thank you. And I have some of the questions as well here in the comments. I want to try as much as possible to go through those ones and the ones I received before this live.
Okay.
D-Real Olanzi noted that, can she conceive naturally after a fibroid, a ruptured ovarian cyst, and endometriosis surgery?
Okay, now that's like a gamut of things happening right there. But to be candid, I would like to know, how old is this person? Because we know that for women, age plays a very key role in fertility. Unfortunately, women are born with all the eggs they would have in their lifetime. They can't produce any more in their lifetime. And the quality and the quantity of the eggs that the woman has keep reducing as she advances in age, such that the older the woman gets, the harder it is for her to achieve a pregnancy. And for most women, by the time they get to 35 years, the process of egg recruitment and egg loss is accelerated, so that by the time the woman gets to 42, 43, most times all the viable quality eggs are gone. So age is important. This person who sent us this question didn't tell us how old she is, because that would also guide us in saying, in advising. Then also we know that endometriosis, fibroid, endometriosis can impact on fertility. For people who are wondering what endometriosis is, the innermost lining of the womb is called the endometrium, and there are tissues that line that endometrium. Those tissues are meant to remain in that innermost lining. But women who have endometriosis, these tissues are found in other parts of the reproductive tract. It can be found in the fallopian tube, it can be found in the ovaries, sometimes even as far as the rectum, the bladder, and this can impact on fertility. But the fact that a woman has endometriosis doesn't mean she can't get pregnant. It could just cause a delay depending on what part it affects. If it is an endometriosis that has moved into the fallopian tube, blocking the fallopian tubes, that might make it difficult for such a person to conceive naturally, because for natural conception, the sperm and the egg must meet inside the fallopian tube for fertilization to happen. So if the tubes are blocked, it's difficult for pregnancy to happen naturally. And then in terms of endometriosis and the ovary, it could, in some of them, they have what we call an endometriosis, which is a thing that is taking place inside the ovary. Inside the ovaries are what we call follicles. Inside the follicles are where we find eggs, right? So if you have something inside the ovary that is taking place, it might make it difficult for eggs to grow to maturity and then for us to even find eggs. So endometriosis can also affect the ovaries in that way, but that doesn't mean that if women who have endometriosis don't get pregnant naturally, there might be a delay, and for some they might need an assistance where we need to do an IVF for us to help the process along. Then in terms of fibroid, so that's another thing that she mentioned. Fibroid and fertility, it depends on the location and the size of the fibroid. Now, if the fibroid is located in such a way that it's not sitting within that innermost lining of the womb, to explain how fibroid could affect fertility, let's look at the womb like a purple, right? Purple. You cut that into two, and then you have two halves. You know, when you have two halves of purple, you have two layers. You have the you have that innermost folio that has the seed. So
Yeah.
that's like the key layers that you have in the. Now that innermost layer where you have the seed in the cocoa, that's the innermost lining of the pregnancy and start growing. So any fibroid features inside that innermost layer or anything distorting that innermost layer will impact on fertility. But if you have a fibroid that is within that yellow part, the fleshy part of the womb, and is not distorting or buzzing into that innermost lining, and it's actually very small, that won't have an impact on pregnancy. And any fibroids outside that. So in terms of fibroids and fertility, we need to look at the location and the size. And if one of that is surgery because of fibroid and there are no other fibroids, and go on and conceive naturally. What was the last thing that was mentioned? Like advice on everything that you have? The question was the question. So for us to be able to answer, if to be able to conceive naturally, I think we need more information in terms of assessment. Yeah, we need to look at energy results. We need to look at if you have a fibroid that is.
Yeah, sorry, Dr. Shittu. I'm not sure something is happening with the volume. We're not really able to hear. So I think people are also noting that I think it's a little better. Perhaps you're far from the.
Okay, maybe I was far from. Is it better now?
It's better now. Okay. Yes, it is.
Okay, awesome. So, like I was saying, for the person who asked that question, we need she will need to be evaluated. For us to look at, we need to know our age. We need to know our ovarian reserve. We need to know if the fibroid that she has, if it's distorting the lining or sitting in a place that would impact on pregnancy getting to term and delivery happening. Then also we need to have an idea of the fallopian tubes. Are they open or are they blocked? Because all those things come into play. Then of course, fertility is not a one-person journey, it's a couple journey. We also need to assess our partner as well, the sperm parameters, because there is this misconception that once a couple are having difficulty getting pregnant, it is always the fault of the woman. That's a big fat lie. The men also play a role in infertility, so the partner also needs to be assessed as well.
Thank you so much for highlighting that, Dr. Shittu. And so we just note to the lady that asked the question that Diri Olanzi, as Dr. Shittu said, I know that you noted here that you're 28 years, but he also asked some other questions that it would be better for you to contact BLOOM Fertility Clinic afterwards for a consultation. That way they can review the entire details and be able to advise you better. And for everyone that has just joined us as well, thank you all for being here. We're having this conversation this morning with Dr. Shittu of BLOOM Fertility Clinic, and he's answering our questions about IVF treatment options in Nigeria. There's also a special gift for everyone that has joined us, and we'll be announcing that to you all shortly. For those that this will also address the fact that the person that also asked about discounts or promotions, that will the gift will address that option as well. So just stay with us. And Dr. Shittu, I'm so glad that you also highlighted that male factor in fertility exists, and that every time there's a fertility issue, it's not just the woman. Of course, in our society, that's something that we need more awareness about, because like you rightly said, people usually focus on the women all the time. But of course, male factor in fertility is rising globally. And one of the questions I had here was a guy that has recently done some testing done, which is great because we want our men to get testing done.
Yes,
yes, exactly. And he said that he was advised that he has azoospermia. So wondering if you could shed some light on what that is and if there are options for him at BLOOM Fertility Clinic in terms of IVF treatment.
Okay, all right. That's fine. Now, I think where the misconception with male factor infertility comes into play is, on the average, most people believe that once a man can ejaculate and they see semen, he automatically has sperm. What we can see is semen. Nobody can see the sperm with the ordinary eyes. It's something that we need to look under the microscope to see if we have any sperm swimming within the semen. What the semen does is it supports the sperm, protects as it navigates through the female reproductive tract to get to the fallopian tube, where it will naturally meet with an egg and fertilize an egg. Now, sperm is produced in the testes, right? And after production, there are certain tubes that now carry that sperm. to mix with the semen, and when a man ejaculates, you now have semen mixed with sperm. So if we do a testing, which is why we tell for a man, for us to assess your ability to impregnate your partner, we need to do what we call a seminal fluid analysis, SFA, to assess that semen to see if there's any sperm inside it. And when we're assessing for sperm, we're trying to look at 3 parameters: the quality, that is the count of the sperm inside that we can see in the semen, the motility of the sperm, which is the ability of the sperm to move, and then the morphology as well, which is the structure of the sperm. Now, these 3 parameters are important because when sperm is ejaculated or released within the vagina, within 2 to 3 days, they die off. And traveling from the vagina to the fallopian tube, where the sperm is naturally supposed to meet an egg to fertilize an egg, a large number of the sperm cells will have died off. But the higher the count, the higher the chances of some of the sperm will get the tube and one will fertilize an egg. So that's why count becomes important. And you need to have at least about 15 million sperm for you to say, okay, yes, the chances of impregnating a female partner is there. Then also motility, they must be able to move very rapidly and very fast to get to the fallopian tube. And that motility, we expect that, okay, of all the sperm that we are seeing, 40% should be actively motile, being able to swim and move. Then in terms of the morphology, we want to look at the sperm. Does it have a head and a tail? The head is what breaks off to fertilize the egg, while the tail is what is responsible for the sperm moving. So if you have sperms with defective head or defective tail. Now, for this person who has this question, the person has done a sperm test and seminal fluid analysis, and they have not found. What azoospermia means is there is no sperm in the semen at all that was analyzed. No sperm at all. Now, if we do that, it could be either of 2 things. One, we want to find out, is sperm actually being produced in the testes? Because if sperm is not being produced in the testes, there will be no sperm to mix with the ejaculate, and there will be no sperm when the man ejaculates. Then the second thing, those special tubes that carry the sperm from the testicles to mix with the semen during ejaculation, is there any issue alongside those tubes? So that will determine the treatment option that we would offer to this person. And then also, there are hormones that regulate this process, because when we start talking about hormones, hormonal imbalance, people also believe that it is only in women. No, men also have hormones. We have hormones that regulate this process: FSH, LH, and testosterone. So those needs to be assessed as well before we can say, okay, this is azoospermia, not finding sperm inside the womb. Is it because sperm is not being produced in the testicles, because there's some issue with the testes themselves, or is it because there's some form of hormonal imbalance? Or is it because there is a blockage in the tube? So once we are able to identify where the issue is coming from, then we can offer treatment. But treatment for people who have azoospermia could include, one, just taking care of the hormonal imbalance, if it's an hormonal imbalance. Now, if it is a blockage along the tubes, there are special kind of surgeries that can be done to try to free those tubes. I like to be honest with people. The chances of those surgeries succeeding and the man having sperm in the ejaculate is about 50-50. It's not always guaranteed that after the surgeries that they will still find sperm in the ejaculate. Then the final thing is the testicle itself. If sperm is being produced, we can actually go to the testicles and do what we call a surgical sperm collection. Go into the testicle and try to get sperm from the source itself. And if all of these options fail, then the final option is to use donor sperm. So those are the treatment options available for people who have azoospermia. But the first step is to identify where the problem is. Once you have been able to identify where the problem is, then you can now offer treatment options.
Thank you so much, Dr. Shittu. That was very detailed, and I'll definitely refer the person to reach out to you at BLOOM Fertility Clinic as well for further investigations. Now, I noted here, I've seen a couple of questions here actually as well. When we started, we noted how Nigeria is now a huge destination for IVF treatment. So someone asked that, does BLOOM Fertility Clinic offer treatment to people coming from abroad? And as well, if you do, Do you have support services for people like that in terms of transportation or accommodation? And can people also start some of the treatment from abroad? So can they have some of the investigations done overseas and then send it to you, or start their drugs from overseas, that way reducing the amount of time they have to be in Nigeria?
Okay, awesome. Fantastic question. Now, yes, we offer treatment to people who are based in diaspora. We have clients in the UK, in Canada, Germany, US. And yes, we can do your testing. You can do your testing wherever you are based, because we know that most countries, most laboratories in the Western world have what we call the ISO certification, because that is important for us, the International Standard Organization certification. And so once they have the ISO certification, we know that the test that they are doing, yes, we can work with those tests. So for patients who are in diaspora, we know that telling them to travel down to come and do their investigations. We know the IVF treatment, fertility treatment as a whole is expensive. Yeah, so they can do their testing wherever they are based. We just tell them this, send them a list of all the investigations that we require for them to do. They do those testing and they share the results with us. And once we look at it, we tell them, okay, yes, we are good to go. In terms of support services, transportation, accommodation, we do not have a designated concierge or stuff like that, but it's something that we can arrange for people who need those services. But we don't have somebody registered with us who does that, but we can help with that as well. We have had to do that for our clients who have come in from diaspora in the past, even not only from Europe, even Africa as well. We have had people who came from Zambia and South Africa. So we can make those arrangements in terms of transportation and accommodations, hotel accommodations. Now, I think the other question asked was, can they start their medication? We know that timing is always very important in terms of logistics. For most people who are based in the diaspora, they may not be able to get so much time to come and treatment, and we know that most treatment facility will last between about 2 to 3 weeks. So yes, for people who are able to get their medication, we can give you your treatment plan and to give you instructions on how to take the medication. We share audio-visual materials so that we have a start your medications wherever you are. They tell you okay, start at social time, and we need you to be at the clinic at the time. So yeah, those logistics is something that we pay attention to, and we try as much as possible to make it easy for our clients as well. So yes, those are available and BLOOM Fertility Clinic. You can do your testing wherever you are, share the results with us. And in terms of transportation and accommodation, yes, that logistics can be arranged. Then certain medication to manage over time, yes, that's also responsible.
Thank you so much, Dr. Shittu, for sharing that. That's very important and helpful for people considering Nigeria from abroad. As well, I noticed someone here has asked that what is the success rate of IVF? And in conjunction with that, is IVF with donor gametes 100% guarantee?
Okay. Now, I like to be honest with people. Yes, a lot of women have gone through IVF treatment services and they have gotten pregnant. But there's nowhere in this world that anybody will give you a 100% guarantee that you will achieve a pregnancy or have a baby when you do an IVF treatment cycle, right? The highest guarantee anybody can give you anywhere in this world is between a 35 to a 45% chance of a pregnancy happening with an IVF treatment, and that's even dependent on the age of the woman. The 35 to 45 is more in women who are less than 35 years because they still have a high reserve of quality eggs. For women who are older than 35, this percentage starts dropping because the quality of the eggs starts reducing. And so by the time the woman gets to 40, the chances of succeeding using IVF is about 15 to 20%. And usually from women above 43 is not recommended for you to use your own eggs to do an IVF treatment cycle, because we know that the chances of achieving a pregnancy are not so fantastic in those age group. And then using donor eggs, I also want to state clearly, increases the chances of a pregnancy happening, but it doesn't give a 100% guarantee that pregnancy will happen. But it increases the chances, because basically what we do when we use donor eggs, we are trying to latch into that pool of women who are less than 35 years. So the guarantee from that is between 35 to 45% as well.
Thank you so much for highlighting that, Dr. Shittu. Very important to know, because I think that's something that many people speak about, is IVF guaranteed, and of course also including donor gametes. Now someone here, yeah, go ahead.
Yeah, I wanted to add that one thing we need to know, that the chances of conceiving naturally, even when the woman is in a peak fertility period, like in her 20s, early 30s, the womb is fine, ovaries are fine, fallopian tube is fine, sperm is fine, there's adequate sexual exposure. The chances of conceiving is about 25% naturally. It's not even up to 50%. So yes, that's something that we need to understand as well. There's a 25% chance that pregnancy would happen naturally with every cycle. So what that means is for every woman, for every couple who have all the parameters, everything is fine, everything is normal, is about 1 out of 4 that will achieve a pregnancy every month, is a 25%. But with IVF, because of the extra thing, because now we are taking out for natural conception to happen. Maybe I should just explain that process, and because that would now explain why the percentage is that low. When the woman ovulates, an egg is released from the ovary, which is picked up by the fallopian tube and travels about midway into the fallopian tube. Sperm that is released or ejaculated within the vagina swims up through the womb, goes into the fallopian tube, where the sperm and the egg now bind together, which is what we call fertilization. This fertilized egg now starts growing and developing until it becomes an embryo, which is it takes about 5 days, then migrates back into the innermost lining of the womb to attach and implant. So there are a lot of steps in that process. So for pregnancy to happen, one, an egg must be released at ovulation. The egg must go into the fallopian tube. Sperm must come into the fallopian tube. The sperm and the egg must fertilize. After fertilization, the fertilized egg must grow to become an embryo. The embryo must move back into the womb to attach and implant. So anything can go wrong along those steps. That's why this chances of conceiving naturally is about 25%. But in IVF, we bypass some of those processes. We actually bring out the eggs, we get the sperm, you can inject the sperm into the egg, and when fertilization happens, you watch them, you keep them in what we call incubators, which have been designed to function like a fallopian tube to allow the fertilizer to become embryos. You now look at the embryos and pick ones with good quality to transfer into the womb of the woman. And that's why the success rate for IVF can go as high as 45%, unlike the natural process where there are a lot of rate limiting steps.
Wow, Dr. Shittu. 25, listening to you talk about the whole lot of work that the egg and sperm had to do before actually happening, it sounds like a miracle that there's any babies at all.
It's a miracle.
Yeah. We definitely need awareness about this. Thank you for sharing. And I think we have a couple of questions about donor eggs and donor sperm. So I'm going to ask a few questions together about what they are. Someone asked about what is donor sperm. Another person highlighted that, do you need to be over 40 to use egg donor, or even at a younger age, can you use egg donor? And with BLOOM Fertility Clinic, are all the donors anonymous, or can you bring your own donor if you have a friend or family that wants to donate to you? Yeah, so if you wanted to please share. Thank you.
Okay, all right, that's fine. So let's start with what donor sperm is. Donor sperm is we have...
Sorry, can you please move closer? I think it's gone a little bit, yeah.
Okay, is it better now?
It's better, yeah. Thank you.
So talking about donor sperm, what that means is we have young men who come in that are screened to be sure that, okay, they don't have any medical condition. History is taken about their family medical history, their own medical history, social history, personality types, hobbies, what they do, and once they tick all the boxes, then of course a seminal fluid analysis is done to be sure that, okay, they also have sperm parameters with sperm with good quality, and then they are now told to donate, they ejaculate, and then those sperm are now frozen. for people, for couples where after investigation we don't find any sperm in the couple, in the man, and then we have tried all treatment options from trying to correct hormonal imbalance, tubes, getting into the testicles, not getting sperm, then they can now benefit from using donor sperms. Then we know that although it's not so common yet in our part of the world, but we know that in the Western world, there are same-sex couples where you have female to female, those can use donor sperm. So that's basically what donor sperm is: sperm from someone else who has donated and is frozen, that can be used by a couple to achieve a pregnancy. And we also know that there are single women who, one reason or the other, want to have a child, don't have a partner, they can use donor sperm to achieve a pregnancy. So that's what donor sperm is. Then the next question was, I hope I'm able to touch on all of them.
I can remind you.
Yeah, okay. I think I remember the question about
age.
donor.
Does it have to be over 40 or even younger than 40?
Okay, awesome. Now, in terms of using donor eggs, yes, we know that age plays a role. The older the woman gets, the lesser the quality of the eggs that we have. And remember, I mentioned that women are born with a fixed number of eggs at birth. And on the average, most women are born with between 1 to 2 million eggs at birth, right? And by the time they get to puberty and start menstruating, that will have dropped to between 400 to 600,000. And every month that the woman has a cycle, a certain number of eggs are recruited, right? Sometimes as much as 500, 1,000, and but the body releases the hormone FSH to make only one egg go to maturity and be released at ovulation. So what that means is, for every cycle that the woman has, once she sees a period, all the eggs in that cycle are gone, and that's how the egg reserve keep reducing. Now, yes, it is safe to say that, okay, the natural pattern is that, okay, by the time the woman gets to 42, 43, all the eggs are gone. But there are women that maybe ab initio, they started with a very low number of egg reserve, maybe we say the average is 1 to 2 million. Some might have 800,000, some might have 700,000, but nobody checks the egg reserve of a girl child at birth. It is when they're having issues. So there are testing that we can do to assess the ovarian reserve, among which is the FSH, or anti-Mullerian hormone. And when we do this testing, depending on what we find, it can tell us if the reserve is completely gone or not. So yes, there are women who are less than 40 who, based on their body and the testing, will need egg donor. So it's not just about the age. We know that, yes, naturally, yes, above 40, but there are women who are less. And once that happens and then we're needing to use donor in someone less than 40, that is termed premature ovarian failure, because it's not expected to happen at that time, but it's happening. And unfortunately, it is what it is. That is what the person has, and there is nothing we can do to make the woman produce more eggs right now. But I know there are a lot of research and studies ongoing. We know there are people doing all sorts of stuff to see if there's a possibility for us to circumvent that, so that we can say, you know what, we might not even need to use donor eggs anymore. With this, we can help you achieve a pregnancy using your own eggs, even when you are above 40, right? So, but for egg donor, it is commoner in women who are older than 40, right? But it is not impossible in women who are less than 40. It depends on what the testing shows. And that is what determines if we are going to recommend donor egg for a woman. Now, the next question is anonymous and
friends or family,
friends or family. Now, for people who are wondering what non-donor, just like the name sound, is a donor that is known to the intending parents. The couple want to use a donor, they know that person personally, right? It might be a friend, it might be a relative, it might be an acquaintance, and usually these non-donors, the couple don't get from the fertility clinic or through any agency, someone they know one-on-one. And yes, you can do that. You can bring in your own non-donor. Then, of course, the non-donor will need to have some evaluation done, because there are certain things that will impact on it. You want to look at the ovarian reserve of the donor herself to be sure that, okay, does she have enough, is her reserve adequate? You want to do your infection screenings, you want to do our hormonals as well, our own physical examination, scans. So yes, you can use non-donors. We allow that you bring the person in, we do the investigations, and then we go on. Now, anonymous donor is a situation where the donor and the recipient, the intending parents, do not know each other. They don't have that identifying personal information. There is a go-between either an agency or the fertility clinic. And basically the information that both parties have for the intending parent is they can get a profile of the donor in terms of age, in terms of weight, height, hobbies, some form of medical history, but they won't have any identifying indicator for them to say, okay, this is who my donor is, and the same thing for the donor as well. They won't have access to any identifying property to say, okay, these are the couple that I donated my eggs to. Now, yes, we do anonymous donor as well. Now, for us to advise whether you want to use known or anonymous, will tell you it's something that we need to think. Each of them has his own advantage and disadvantage, right? Now, for using a known donor, some of the advantages could be that, yes, people are more comfortable because they can get more information in terms of, I know this person, I know what this person does, I know. And then for the donor conceived child, which is the child conceived through donor treatment, at least for identity, you can like, okay, well, yeah, you were conceived through donor eggs and that's your biologic mother. So that's another advantage that you can get from that. Then you can, in using known donor, it can be similar genetics, right? You can say, okay, I want to use maybe my brother, I want to use my sister, I want to use my cousin. I know this person. I know that, okay, yes, this genetic linkage is there for this. But in terms of disadvantage, now it might breed in future for non-donors. You might have issues where some non-donors might not be interested in how, yes, they don't have any legal claim on the child because consent has signed to say, okay, yes, I'm donating to this person. Might not have a legal right on that child, but he might want to say no. But I want to have a say in how this child is raised, what this person does, because this person is still biologically my child. So that might create some issues. You understand? And some donors might feel pressured because, assuming, let's say in a scenario where a sister say, okay, you know what, can you donate your eggs to me? Because that person doesn't want to hurt her sister's feelings. She might not really want to donate, but which kind of will be this now? If I say no now, okay, you know what, I would donate, but might not be willingly. It might be like a pressure. You understand? Right. Then of course, advantage of using non-donor is that, okay, cost is also reduced because there's someone you know. But unlike anonymous donor, now there are some costs attached to that because yes, you have to compensate. You can't put a price on eggs, right? But you can compensate the person who donated the eggs in terms of, okay, cost of transportation coming to the clinic, then inconvenience injecting and all those things. So there's a compensation that goes there. Then also in terms of some couples love the idea of anonymous donation because there's still some form of stigmatization. Some people are not comfortable telling people that I use donor eggs. So using an anonymous donor can make it like, okay, it's secret. But that is gradually changing because people are evolving. They are realizing that there are many ways to being a parent. Using donor eggs doesn't mean that, okay, yes, I'm still not a parent. I gestated, I carried this pregnancy, I delivered, I'm nurturing this baby. So this child is as much my baby as the person who donated the biologic egg. So yes, anonymous donor eggs, known donors are allowed at Bloom, but you just need to understand, we have that conversation with you. We do the counseling so that when you're taking that decision, it's an informed decision and consents are signed. So we don't put a restriction saying, no, for us, it's only anonymous donor that we do. We can bring in your known donor, we investigate, and then we take it up, and that's it. I hope I've been able to answer all.
Yes, you've been excellent. Thank you so much, Dr. Shittu. This has really been very informative and helpful. I'm sure all our listeners have also they've learned so much. Thank you all for joining us. We have about 15 more minutes for this live with Dr. Shittu. So please, please, put in your questions and let's try to ask as many as possible within that time. And of course, we're going to be announcing the special gift from BLOOM Fertility Clinic shortly as well. Now, I think you mentioned a part of this during your recent talk about AMH test, but just to be more specific, someone has just highlighted here that is there a way to check how many eggs she has left, because she's not currently ready to have a child at this moment. And so they're testing for that, and if there are options for someone that might find out a result and wanting to preserve something for the future.
Okay, all right, awesome. So now, in terms of ovarian reserve testing, nobody can actually tell you how many eggs you have left. The testing just gives us an idea of what the reserve is, right? And then we can either do that by doing blood test. There is the follicle stimulating hormone, and then there is also the anti-malarial hormone, AMH. Then we can also do a scan. By doing the scan, remember I mentioned that inside the ovaries are what we call follicles. Inside the follicles are where eggs are. So you can count the number of the follicles that you can see. That also gives an idea of the reserve of the egg of the woman. But one catch with the intrafollicular count is we know that some of those follicles naturally don't have any eggs inside. Some have eggs inside, some don't have any eggs inside. So, and it is difficult to ascertain just by doing a scan which has an egg, which has an egg inside or which doesn't have an egg inside. So, but you can count and just say, okay, yeah, please, if I'm counting and I'm getting at least about 5, 6, 7 per ovary, then the reserve should still be adequate. Now, in terms of the blood testing, the follicle stimulating hormone, just like the name sounds, is an hormone that is released by the brain. It goes to the ovary to ensure that, okay, follicle with the egg inside, follicles grow to maturity. And then when you measure the value of the FSH, you can ascertain what the reserve is. And it's an inverse relationship. The higher the value of the FSH, the lesser the reserve of the egg of the woman. Because what that means is, because the reserve is going low, the body now needs to release more FSH to stimulate the ovary for the follicles to grow. So ideally, you want, if the FSH is being used as a marker of ovarian reserve, you want it to be ideally less than 8. Anything above 8 is telling you that the reserve is getting low, right? And the FSH is done at a specific time of the period, between second day to the 4th day on the period is when it is done. But the world is gradually shifting away from doing FSH because of the anti-malarial hormone. It's a more sensitive marker. The reason being that the anti-malarial hormone is actually released by the follicles that have eggs inside. You understand? So it's coming from that. So once you measure the value of the AMH, is a stronger marker of the ovarian reserve. And once you do that blood testing, it gives you a range as well, between 1 to 3.5 nanograms per ml. Any value less than 1 is telling you that the reserve is depleting. Any value higher between 1 to 3.5 telling you, okay, the reserve is still adequate. Then any value higher than 3.5 is telling you, okay, this person could either have a polycystic ovarian syndrome, or the reserve is just very, very fantastic. But you need to look at other things for you to say, okay, does this woman have polycystic ovarian syndrome or not? Now, for someone who is not ready to have a child now, right, and still wants to give herself the chance of being a biologic mother, like we mentioned, the quality of the eggs keep reducing. And I know that the ovaries are good,
women get pregnant, have a baby, the goalpost has been shifted compared to what.
Sorry, can you move closer? Yeah.
Okay, the goalpost has been shifted compared to what used to happen in the past, where between 21 to 24, people started 24. Now, women are choosing careers, they're trying to have some form of financial stability before having children, and of course, you need to have a partner. You still can't hear?
It's better now.
Okay, I'm almost inside the
Sorry.
Maybe I just need to project more. So we know that women are delaying conceiving and having children. Reasons being chasing careers, trying to have some form of financial stability, because we know that raising children involves a lot of money. And then, of course, the factor, do I have a partner that I'm comfortable having a child with? So for those women, once you do the testing, we say, okay, first and foremost, do your basic testing, ovarian reserve. Once you find what it is, there's something called egg freezing. You can actually freeze your eggs and have that as a backup, so that if at the time when you are ready to conceive, maybe your reserve has really depleted, you can now fall back on the eggs that you have frozen in the past. Now, what egg freezing does is, if you freeze your eggs at maybe when you were 28 or 30, and you decide at 43 or 44 to have a child, what you have done in essence is you are giving your 43-year-old self the chance that your 28-year-old self would have had at getting pregnant. So that's what egg freezing does. That's what egg freezing does. So for women who are single, who are looking at, well, I'm not looking at having a child, the first thing is do your ovarian testing. Then you can freeze your eggs and have that as a backup. It doesn't mean you have to use the eggs. You might conceive naturally, but at least you have that confidence to say, okay, at least I have something frozen. So that's something that is becoming increasingly popular right now. So yes, egg freezing is available, and it's something that we offer at BLOOM Fertility Clinic as well.
That's wonderful. Thank you. I'm glad that you actually highlighted that as well, that it's available at BLOOM Fertility Clinic, just so that everyone knows that you can contact you afterwards about the options that they might want to consider. So we have just a few more minutes. I do want to speak about the special gift that you have for all our listeners. But I just wanted to have one question that I want to see if you can answer quickly. People always wonder, are there ways that they can improve their options when they're going through IVF? Is there something they need to be eating? Or is there just something that, regardless of what they try, the outcome will be the outcome? Like, how can are there ways for them to increase the success of their cycle?
This is something I think we need to talk about. Yes, we know that when we talk about fertility, there are a lot of things that could impact on fertility. One is our lifestyle choices, right? Do we drink? Do we smoke? Are we sleeping adequately? Are we overweight? Are we exercising? The kind of food that we eat. I like to state clearly, there are no specific food that are magical for fertility. What we say is a balanced diet, plenty of fruit, plenty of vegetable in terms of feeding. Now, sleep as it is can impact on your fertility, not having adequate sleep or even oversleeping. Adequate sleep is between 6 to 9 hours. Sleeping less than 6 hours can impact on fertility. Sleeping more than 9 hours, because this can impact on the hormones that regulate this process. So just sleeping 6 to 9 hours every day can improve your fertility. Smoking, drinking, all this can impact on the quality of the egg and the quality of the sperm as well. So for people who smoke and who drink, we tell them, cut down if you can't stop, right? Then also being overweight or being underweight, weight also can impact. So being overweight can affect the chances of a woman conceiving, and also can have an impact on the quality of the sperm. Being underweight can affect a woman's ability to conceive, because it affects the hormone. So the most important thing is we all need to have an idea of checking our BMI. BMI is checked using your weight and your height, and ideally when you check the BMI and values less than 18, means that the person is underweight, and that could impact on the fertility. And values between 19 to 24 is what we term as normal, right? And then values from 25 to 30 is saying overweight. So for BMI, usually for women, we want to at least keep it 30 downwards. But we don't also want you to have 18 downwards. So at least if you are keeping 30 downwards, then try to maintain between 19 to like maybe 24. That's normal. So weight also can impact on fertility in both men and women. Then also in terms of what can be done, we know environmental pollution has an impact. When we say the quality of the eggs, the dipping quality of the sperm, a lot of time is stressor factors from the environment, what we do, then what we are exposed to. For some people, maybe they work in oil and gas, pesticide, herbicides, people who work where they make paints. So all of these things are pollutants that come into the body that would impact on fertility. But there are certain medications that are called antioxidants that helps to mop up these toxic substances in the body. So some of these antioxidants can help with that. But basically what I would say, your chances of increasing your fertility, lifestyle choices, simple basic thing, ensure that adequate weight, exercise, and then for exercise as well, it doesn't have to be too strenuous. If you over-exercise, you're looking for trouble. If you under-exercise, you stand the risk of being overweight. But at least about 45 minutes to 1 hour, 3 times a week is enough. You're not going to the Olympics, you're not an athlete, because being an athlete also has its own impact on fertility as well, because when the trainings and some of them use some medications that could affect the quality of the sperm and the egg as well. So exercise is just for you to feel good, maintain your weight and feel happy. So 45 minutes to 1 hour, about 3 times a week is fine. So exercise, cutting down on smoking, drinking, adequate sleep, balanced diet. Something popped into my head and popped out as well. And okay, caffeine. Yeah, caffeine for people who take a lot of caffeine, that also can impact on fertility. So those basic lifestyle choices can improve your fertility.
Thank you so much, Dr. Shittu. I feel that we all have been so educated this morning. I think we're ready to definitely improve and do all that we can within our power to improve our fertility. And then, of course, also aware now of the options that are available so that we can make informed choices, and we can contact BLOOM Fertility Clinic as well. So thank you so much for your time, for dedication, for your passion in answering all the questions as well. I know that, listening to you, you can tell that you're very passionate about what you do, and supporting individuals and couples who are trying to conceive. So thank you so much.
Thank you for having me as well.
It's
been an absolute pleasure.
Yes, it's been great. And thank you all that have been here with us, have listened so far and asked questions as well. Very important. We have to definitely keep this going and having this conversation. So thankful for BLOOM Fertility Clinic, and I know that they will be doing this again in the near future to ensure that we are better educated and we know the options that are available for us. And BLOOM Fertility Clinic has a special gift for everyone that has listened and joined us today. There's a 10% discount that's been offered to every single person. Yes, that's money is a huge thing when it comes to fertility treatment. So every discount, every saving matters. So 10% discount is huge, and it covers your fertility assessment test. All you have to do is send a DM to BLOOM Fertility Clinic, which the hashtag, I'm going to put it here as well in the notes. Oh, perfect. South Shore has done it. Yeah. So send them a DM, hashtag FertClear to BLOOM Fertility Clinic to claim the 10% discount on fertility assessment test. So thank you so much, Dr. Shittu, for offering that discount to us all. It goes a long way. And of course, for anyone that wants to proceed and do further investigations with BLOOM Fertility Clinic, you know what to do. Send them a DM, get that discount, and then book your appointment to see Dr. Shittu. And we wish you the best with your fertility journey. Dr. Shittu, any final words, comments that you want to make before we end this live?
Yeah, I know that fertility can be really emotionally and financially tasking, especially in our own in our culture, where the yardstick for measuring success of a couple's journey is the ability to conceive, right? But there is a light at the end of the tunnel. If you're battling with this, if you're having difficulty getting pregnant, remember that all you need to do is just go to a center where you can be adequately examined, evaluated, and then there are treatment options available. So don't lose hope. There is a light at the end of the tunnel. It is a journey with an end in sight. So for me, that is, if you don't go away with anything, go away with the fact that yes, there is a solution to whatever problem it is that you're facing in terms of your fertility. You just need to take that step and start that journey.
Thank you so much. That was very comforting. And as a person currently trying to conceive myself, I know how comforting and nice to hear you as a doctor say that. It's so important to have a doctor that that supports you, that understands, that empathizes, that is compassionate when going through fertility treatment. Fertility treatment and the journey itself is hard enough. So having someone that you feel that you can connect with and talk to and listens to you is huge. So thank you so much, Dr. Shittu. I know of your great work, and thank you so much for all that you're doing and what you continue to do to support us. We really appreciate you. Thank you.
I also want to thank you all and Fertility Conversation, because you need to be applauded. We need to do more of this. I know in your own way, you're a support system. You like you mentioned, you understand how it feels. You are going through it, so it's easy for you to discuss, and that's something that we encourage people to do. Peer support peer support is important, because you need to know that you are not alone. There are other people who are going through this, and that helps in making it easier to go through this journey. So thank you very much for all you do as well, and well done. I'm applauding you.
Thank you so much. Thank you so much. Great session. Thank you all for joining us. I'm going to save the live and we'll have it on as well for people that want to join later. And thankfully, BLOOM Fertility Clinic has also confirmed that they would extend the discount as well to people that listen. So thank you so much. And do have a wonderful day, Dr. Shittu, and South Shore, Lagos as well. Thank you all. Thank you so much, everyone. Have a wonderful day and weekend.
Bye.
Bye. Thank you.